Hello, I'm Emily Ryder. I'm a Programme Manager for Cycling UK, and along with my colleague Shona, we're going to talk through 4 of our projects in Scotland and show how, through those projects, we enable access to cycling in a variety of different ways. So the first project I'll talk about is Wheelness. So Wheelness was set up in 2018, initially conceived as a research project. It was only ever supposed to run for 1 year. Ended up running for 3. We just ended it this year. The idea behind it was that we could give free access to bikes plus a tailored programme of support, and that we would increase health and mobility, address transport poverty, and reduce isolation as a result. We wanted to work with people who wouldn't otherwise be able to access bikes and cycling. So for whatever reason, but largely the people that we worked with, it was because of their health, because of where they lived, or for financial reasons, they weren't able to access cycling. The plan had been in the first year to support 150 individuals, and this project ran in the Inverness area. So we worked with local medical professionals, community groups, bike shops and other third sector organisations. They referred people through into the programme, and that was really fundamental to the success of this project, because we were looking to not just provide a bike with it. We know that if we could just give everybody a bike, it's not enough. It won't make them ride it. So we had a really key relationship with the 3 local bike shops as well, because what we aimed to do, or what we did do, our 2 development officers were able to tailor the support that they were giving to each individual. So everybody that took part in Wheelness got a bike that suited their needs, so it wasn't just the same bike that everybody got. And along with the bike, they also got accessories. So everybody got a bike, a lock, helmet, lights, and then again, sort of tailoring. People who needed panniers could get panniers. If you needed a waterproof jacket, you could get a waterproof jacket. Because we know that these things will make a difference to whether you use your bike or not. And the bike shops were fundamental to the success of this, because obviously they could also advise on the types of bike that people might need or want or use, and support with maintenance and signposting. And the community groups and third sector organisations were also crucial for this. So in terms of results, we managed to get 224 bike loans out there across the 3 years of the project. And of our participants, 86% of them had health conditions, were on low incomes or experienced transport poverty. So it was a massive success, and we met and exceeded our targets at every turn. I should also say that the vast majority of our participants are still using their bikes, which I think is a huge a ringing endorsement of this project. The very few people who left the project, it was largely because their circumstances changed. So whether that was moving away or their health condition changed or deteriorated, or a very few of them felt cycling actually wasn't for them, but the vast majority are still riding Wheelness bikes. And I just want to highlight one of our case studies. So this is Charlie. Charlie is in his 80s. He was referred to the project through Velocity. So if you've been to Inverness and you're interested in active travel, I'm sure you're aware of Velocity. They are a bike shop and a cafe, and they do lots of community work as well. So because of his age and his mobility, it was a standard upright bike was deemed to be not suitable. So we provided him with an e-trike, and he is a frequent participant in group rides and continues to ride daily for exercise, which I think puts some of us younger people to shame, certainly me. So that's just one of our wonderful case studies from Wheelness. So the next project I'll talk about is the Shetland project. So through an EST grant, we bought 7 adaptive bikes with the Shetland Island Council for use by their community health and social care team. Because of the pandemic, they didn't arrive in Shetland until July 2020. The aim had been to start this project earlier in the year. But once they did arrive, they were assigned to different residential homes across the Shetland Isles. So it was really important to us with this project that these cycles weren't just in Lerwick, that they were across different communities and could be used by different communities. So there were 3 care homes on the mainland of Shetland, so in Lerwick, in Was, which is in the west of Shetland, and in Leavenwick, which is in the south of Shetland, so kind of getting a good geographical spread. And we also had locations on Unst, which is one of the islands, and Walsa, so it's another island as well. And the kind of aim of this project was for staff to use these cycles instead of cars to take residents for short trips, either to the supermarket or out for a coffee. And as you can probably imagine, during the pandemic, this has been especially important and has given them, it's allowed them to go out and sort of, is one of the stories which is really nice, is about a resident from one of these care homes cycling past the local primary school and all the primary school kids giving her a wave. And yeah, in a year when residential care home residents have been quite stuck, it's given them a really nice way to get out and about and get some fresh air and exercise. And so yes, as I say, clearly the bike use that we had anticipated in our initial bid has been curtailed, but I'm pleased to say that they've still used them a lot, and that they've been adapted to suit the needs of the residents during this difficult year. The clients, as you can see, the residents are relatively old, relatively elderly. They were also, one of the bikes was also lent to Ability Shetland, who work with younger people with learning disabilities. So that's why we've got an 18-year-old in there as well, and a good spread of male and female participants too. So I'm just going to leave you with a couple of lovely quotes. So I think this support worker sums it up really, that they're one of the best things that's ever happened to the residents. All of the feedback we've had from this project has been super positive, and I think that, yeah, although we're no longer really involved, they will continue to use these cycles and get lots and lots of benefits from them. So I'm going to pass over to Shona now, and she's going to talk through some of her projects.
Thank you, Emily. So I'm also a programme manager at Cycling UK here in Scotland, and one of the projects I manage are the Bothys. So Emily, are you able to click onto the next slide? Grand, thank you. So we have 5 Bothys across Scotland. They're not all physical locations. The one in the picture here is in Ardrisig, but we cover one in Ardrisig, one in Inverclyde, one in Dunoon, one in Aberdeenshire, and one in Golspie. The purpose of the Bothy is to enable walking, pedaling and cycling in a community grassroots level, working with partners and helping to bridge the gaps to reduce the barriers, basically. The projects are funded through a variety of funding streams, mainly Smarter Choices, Smarter Places, local authority funding, and local health board funding. So we have lots of different outcomes. It's not all about active travel, it's about getting people active, creating community, socialising, reducing inequalities, and making everything a wee bit more accessible. So we work with local health practitioners, with community organisations, regional parks, local authorities, community councils, different kind of youth community organisations. There's lots of different ways we're involved with people, whether that's through utilising their space for meetings and training, upskilling people, or sharing resources, or to get people along and have them as volunteers to help out on the project, and vice versa. And there's lots of good skill sets in the communities that we work, and we try and make the resource go as far as possible to create a positive change. We also do a lot of localised campaigning. We respond to consultations, we sit in on focus groups to try and help put a positive spin for walking and cycling on any infrastructure improvements that are being planned. And we definitely try and feed back the voice of the community that when we're out doing walking and cycling activities, what we hear on the ground, that gets passed back to the kind of decision makers. Ultimately, we want a greater sense of place and community through the work that we do. So I'm going to talk about a nice case study from this particular Bothy in Ardrisig. So this is a photo here of John and Margaret with Bothy coordinator Alec. And they had been out using the tandem. So they initially found out about the project by they live local to the Crinan Canal, and that's where the Bothy is based. For those of you who might not be familiar, that's just outside Lochgilphead. And again, if you're still not familiar, then that's in Argyll, and it's fairly rural, limited kind of public transport. So Margaret and John had seen Alec out, kind of physically out doing stuff, walked past the Bothy and got talking to him. And Alec had told them about the health walks, so short, accessible, kind of 1 hour long health walks, and also his strength and balance training. So that's short activities that help people that have maybe been sit around for most of the day, that aren't up and walking around. Helps them to build that strength in their legs again, and with stability and balance, so that they can build up their strength. They can start to go out on walks and keep their independence. So John and Margaret liked the idea of these health walks, and they started to come out on a few. Alec got to know the couple a bit more, and it turns out John's got quite advanced Alzheimer's, and Margaret is his full-time carer. So quite a tough job for Margaret, full on. So one activity Alex suggested was that maybe he'd like to get out cycling. He'd previously enjoyed cycling in his younger days. They're in their 70s now, and Alec had suggested he could take John out on the tandem. So he did that, and John loved it, and it gave Margaret a wee bit of time to herself as well. But then Margaret quite fancied to go on the tandem as well, and Alec trained her up as the pilot to go on the front of the tandem, which meant they could do an activity together that wasn't walking. They could go a wee bit further afield, and they can go along the Crinan Canal and different routes, which was lovely. But then Margaret also gets a half day off, kind of respite during the week, and wanted to try some of the other lovely bikes and e-bikes that Alec has at the Bothy. So Margaret had been enjoying getting familiar with one of the e-bikes and going out a wee bit further than she would on the tandem, a wee bit faster, and exploring her local area. She really enjoyed having the wind in her hair, and it gave her some really nice, enjoyable me time. The family now can't wait to get out on the bikes as a full family unit. It's a nice activity that they can all do and go and explore the area, which is a really nice thought. Okay, so the next project I'm going to talk about is Rural Connections. Excuse me. Rural Connections is a new programme for this year. It's a pilot project. It's funded by Smarter Choices, Smarter Places through Paths for All. And we are focusing on 7 local authority areas that have that are classed as being rural. In total, there are 14 in Scotland that are classed as being rural, and we focused on 7 of them in the first year. Those 7 areas are Orkney and Shetland, Highland, but in particular the Caithness areas, so Wick and Thurso. Then we have Western Isles and Moray, Argyll and Bute, and the Scottish borders. In each area, we have a dedicated development officer, and the outcome, or the aim of the project, is to encourage and improve walking, wheeling and cycling for everyday journeys, leisure and adventure. So again, trying to move away from the push on solely active travel, because that's not necessarily an attractive buzzword for people living in these communities where the infrastructure isn't the same as in our more urban areas, and the distances and the topography is not the same. It's all a wee bit more challenging. So by embedding leisure and adventure in there, you can start to bring together a much nicer kind of sense of a project, and it's a wee bit more appealing to people. We have a large pot of money to buy bikes and have them distributed to the communities across these 7 local authority areas, and the development officers that is their role basically to get these bikes out there, get people on them, and support them to do so. We've got a range of standard and non-standard cycles that we want to get out. Some we can give out to individuals ourselves, others we will support community groups, get them trained up so they can loan them out for free to their service users. Our aim is to engage with 5,000 individuals across the project, which is a 12-month project. We're off to a great start, so that shouldn't be an issue. And we also want to bring together all the different networks within these local authority areas, because there are lots of wee pockets of activity, but it doesn't seem to be fully joined up. And there's not one voice, and we want to be able to kind of link all that up, share resources, and make sure we can make the resource go as far as possible, basically, and try and really influence decision makers as well. So tapping into local authority active travel strategies and respond to consultation on that to help make positive change. So I've got a nice case study from this project as well. So this is a group in Caithness. It's through the Caithness voluntary group, Dunbeath, and they put on regular walks. So this isn't a walk that we set up. We can support other partners that already have walks. We don't need to create everything from scratch. It's about enabling as well. Excuse me. And we were able to provide this all-terrain wheelchair for you. So George, who's a development officer in the Caithness Highland area, sourced these paratrekker all-terrain wheelchairs. And it just means people can, that maybe thought they couldn't access walks and activities and places that are a wee bit off the, standard tarmac paths, actually can. So this is an example of that, basically. This walk was at St John's Pool. It's a bird watching area. And then they headed into Dunnet Forest as well. So it's a lovely example of how maybe someone that thought they couldn't get on one of these regular walks actually can. Yeah, just a really nice story. We've got 2 of these bikes so far. Not bikes, sorry, wheelchairs. And the other one is at a day centre for adults and kids, which will be great to see how it changes people's lives in all different ways. This is just one example, and I'm sure we've got many more to explore. It's helping us reduce barriers and get people active and create that nice sense of community. And yeah, it's a nice project to get off the ground this year. We'll have lots more examples of this. We're wanting to buy all sorts of non-standard cycles that actually fit the needs of the community, rather than just storming in with hand cycles and X, Y, and Z. We want to make sure that the non-standard cycles and potentially more of these all-terrain wheelchairs are exactly what the community want and need, and will help get them over those barriers that prevent people getting active. So that's it for me. I hope you've enjoyed listening to our case studies. Thanks very much.